So this weekend has been a very special experience for me as well. It was a very short weekend and very packed. I didn't get around to count the shiurim I said while I came into town, but I will do that, Bezrat Hashem, on the plane on my way back. So Baruch Hashem, it's been an uplifting weekend, a beautiful Shabbos, and our visit is coming to an end, and I think this kenes, this assembly, is of extreme importance to me, to physicians, and to us all. And I think that the interaction we are trying to create between medical professionals and Rabbonim and halachic poiskim is of extreme importance. And many times I say to my Talmidim in Eretz Yisrael and elsewhere that our generation needs Gedolim of the caliber of the Ramban and the Rashba. Nothing less, because the unbelievable advance of science and technology and everyday new medical procedures and breakthroughs and ideas. Dvorim shelo sha'arum avotenu, and sometimes we stand humbled by the tremendous responsibility and challenge that our generation has, dealing with so many shilas of extreme severity, and sometimes we don't even find any sources in halachic literature to deal with those problems. So we truly need the great Rishonim, but they're not around. So somebody needs to rise to the challenge, because these questions demand answers. And so I think it is of extreme importance in our day and age, the interaction between medical professionals and Rabbonim, and to solve the many complex issues confronting this most important of all professions, because we are dealing with questions of life and death. And there is no greater mitzvah in the Torah than to preserve life and to save life. Pikuach nefesh, as we all know, overrides doicha kol ha-mitzvahs sheb'Torah. And you and we are dealing with pikuach nefesh on a daily basis. So the specific topic we will be discussing today is, as my dear friend Dr. Tenenberg, and I profoundly thank Dr. Tenenberg for organizing this important session this morning. Let me take the opportunity to thank my dear friends, Moshe Rose and Dr. Steve Tenenberg, for putting this entire weekend into motion. So the topic we will be discussing today, as expressed by Dr. Tenenberg, is to what extent is a physician required to put his life on the line or jeopardize his safety in order to help others? Is a person, physician, maybe physician has a special din, as we will see soon, but generally, is a person required to expose himself to a lesser degree of sakana in order to save others from imminent danger, when the sakana upon them is greater than the sakana he is exposing himself to? To what extent does a person have to endanger his own personal safety or life to salvage others that are in a far greater sakana? So this discussion starts off with the Yerushalmi, but how would we know where the Yerushalmi is? The Beis Yosef and Choshen Mishpatzim and Tov Chavav brings the Hagos Meimoniyos, Marabu Yisenu Harei, that a person is mechuyev, he is required to put his life in danger to save another person who is in greater danger. That is the Beis Yosef quoting Hagos Meimoniyos, quoting a Yerushalmi, without letting us know which Yerushalmi and where that is. However, this halacha is found in Beis Yosef, it is not found in Shulchan Aruch. And generally speaking, when we find the halacha in the Beis Yosef, and that same halacha is not brought in Shulchan Aruch, the question is, why? The Shulchan Aruch usually reflects the Beis Yosef, and the Beis Yosef is the elaboration and the halachic basis of the short Piskei Halacha that are brought in the Shulchan Aruch. So how do we relate to a given halacha that we do find in Beis Yosef, but we do not find it in the Shulchan Aruch? The Chidah says there might be three different explanations. If it is a milta de lo shchicha, if it is an uncommon halacha, then the Beis Yosef trying to keep the Shulchan Aruch as short and relevant and precise as possible, so no need to put every halacha which is remote into the Shulchan Aruch. Explanation number two might be, if we could learn this halacha from a different source in the Shulchan Aruch, that is reason enough for the Beis Yosef to omit it. Because if we could learn this same halacha from another halacha somewhere else in Shulchan Aruch, once again, because the Beis Yosef wanted to keep the Shulchan Aruch as short as possible, he didn't like to duplicate and write the same halacha in two different sources. Explanation number three is, ultimately he decided that this is not halacha l'maisa. So it is brought in the Beis Yosef, because Beis Yosef is discussion, it is dialogue, it is a broader dealing with halachic principles. But if it's not in the Shulchan Aruch, then it is not halacha psuk. In our case, I think only explanation number three would be relevant, because this is an extremely relevant halacha that comes up in many different circumstances. It is a halacha which we do not learn from any other source in the Shulchan Aruch, and therefore it would be fair to reason that it is not found in the Shulchan Aruch, because ultimately the psak of the Shulchan Aruch is that a person is not required to put his life on the line to save others. Even if the danger resting upon those others is greater than the danger he might be exposing himself to, that is not a halachic requirement. And that is what the Sma argues in Siman Tov Chavav, halacha l'maisa. A person is not required to put his life in danger to save others from a greater danger. So he was not required to do so, but is he entitled to do so? Would that be an isser, or maybe it is permissible? It is not a chiyuv. He is not obliged to do so. But if he wishes to put himself in danger, he is entitled to do so. And the basic rationale being, the danger I am exposing myself to is lesser than the danger I am saving another person from. So some great halachic authorities maintain, yes, that is permissible. The Netziv, in his commentary on the She'ultas that Rav Achai Goen Hemek Shalasin and Kuf Chavtes, and the Tiferes Yisrael, Perek Ches, the 8th Perek of Masechet Yuma, that is their opinion. Tshuvas HaRadbaz, we find two tshuvas, and there seem to be contradictions between the two. But I think those two tshuvas of the Radbaz are the most important sources to reach a halachic conclusion in the question we are dealing with. So in Chelek Gimel of Tshuvas HaRadbaz, it is Siman Tov Reish Chov Zayin, that Radbaz deals with an outrageous question. And it is only Jews that had to deal with these insane, outrageous, and crazy questions throughout the ages. That is part of our story, part of our destiny. So non-Jews confronted a Jew and they said, either we cut off your hand, either you give us a limb, or we will kill your fellow Jew. Does he have to give away a limb for no obvious reason? Well, 500 years ago, they didn't do transplants. And to the best of my knowledge, today they don't transplant limbs. But it was just crazy. But the Jew was confronted with an impossible dilemma. Either he gives away a limb, amputation. If not, they'll kill his fellow Jew. Does he have to agree that Adbaz says no? And he reels off about 10 reasons why, in his opinion, a person does not have to give away a limb to save a fellow Jew. Between the many reasons, he writes, well, every amputation involves a great sakana. Even today, it is major surgery. Going back 500 years, it probably was devastating. And then Adbaz writes, Be'enai ru'isi, I have witnessed a person that had a cut in his ear and he bled to death. Obviously, he had hemophilia, which in previous generations they weren't familiar with. So that Adbaz says, every amputation, cutting off a limb, always involves sakana, and a person does not have to jeopardize his life to save another life. That is one of the reasons, and maybe the basic reason, that Adbaz expresses. And the other tshuva in Adbaz is in Chelek Heisim and Reish Yud Ches. Once again, dealing with the basic question, to what extent does a person have to put his life in jeopardy to save another? On one hand, that Adbaz writes, it's a midas chasidus, not a chiyuv, but a midas chasidus. And then it goes on to say, if you're exposing yourself to substantial skona, he is a chosid shoita. So when we combine these two tshuvas in Adbaz, number one, he does write sometimes it would define as midas chasidus. In tshuva number two, he writes, if the situation is noita el hahatzola, it is even a chiyuv. Chiyuv, reshus, chosid shoita, or midas chasidus. Obviously, what we need to take away from the Adbaz is there are different levels of sakana. When the sakana I am exposing myself to is minimal, it might even be a chiyuv. If it's a great danger, even though that other person is in even greater danger, according to the Adbaz, it would be a prohibition. If the danger I am exposing myself to is substantial, but it is still far less than the danger upon that other person, it would be defined as a midas chasidus. That is the scale according to the Tshuvas HaRadbaz. It is interesting that the Chassam Sofer, the greatest halachic authority of his generation, going back almost 200 years, but this Chassam Sofer is not found in the response in the Tshuvas of the Chassam Sofer, but rather Chidush Chassam Sofer in Ksubas Daf Samach Aleph, quoting the Radbaz, and he says he doesn't understand the Radbaz, and the Chassam Sofer argues. If the danger resting upon that person is greater than the danger I am required to put myself into, I am mechuyev to go very far to save another person. So the Chassam Sofer once again goes very close to the Beis Yosef and Agos Maimonides, quoting a Yerushalmi. There's an amazing chiddush in Rishon LeZion. The Orach Chaim, you're all familiar with the Orach Chaim HaKodesh Al HaTorah, but he wrote many sforim. One of them is a Sefer on Yoreh De'ah, halachic ruling. The name of the Sefer is Rishon LeZion. And Rishon LeZion, he goes to the extreme of arguing. Not only is a person entitled to put his life in danger to save another, a person is entitled to give away his life directly to save another Jew. And when Rebbe Kiva Mesechet Bava Metzia argued, Chayechu koidme lachayei chavechu, in the famous dilemma, Shnayim holchem b'derech, v'yesh b'nehem kiton achad shel mayim. Two people are lost in the desert, and they have one bottle of water. It seems likely, if one would keep the entire bottle to himself, he will make it, but his friend will perish. If they split the water between them, probably none of them will make it. So Ben Petura said, Yishtu shneim v'al yira achad b'moto shel chavero. Ad shebo Rabbi Kiva v'limed chayecho kodmim l'chayei chavecha. So the vast majority of commentators and Poskim say, according to Rebbe Kiva, it is not only that the one that possesses that water is entitled to keep the water to himself, he is obliged to keep the water to himself, because chayecha kodim chayecha vercha. The Orach Chaim argues, no, it is a permit. It is permissible to keep the water to himself, but if he wishes to give away his life to save his fellow Jew, he is entitled to do so. And that is an extreme opinion. Not only is he entitled to put his life in danger, he is entitled to directly forfeit his life and bring about his demise to save another Jew. But that is a das yochid. A das yochid that has somewhat of a source in Sefer Hasidim. Sefer Hasidim is one of the more interesting of our halachic sources. One of the great Rishonim, Rabbi Yehuda HaChassid. But it isn't really a halachic work. More divrei Hasidus and divrei Kabbalah, but it is an extremely important source. And the Sefer Hasidim, Ot Tov Reish Tzadik Ches, says that a Talmud is entitled to give away his life to save his Rebbe. A Jew is entitled to give away his life to save a Godel B'Yisrael. And that is a unique approach. Not all people, or all people are created equal. Yeah, that is a basic axiom, especially in America. But no, not all people are equal at the end of the day. So some people have achieved great heights, and they are the leaders of Klal Yisrael. So according to the Sefer Hasidim, a person is entitled to give away his life to save another life if there is some basic justification. So Sefer Hasidim quotes Rabbi Reuven Astrobali gave away his life to save Rabbi Kiva. And we're not totally familiar with that story. It is nowhere to be found in Bavli or Yerushalmi. But it is a story upon which the Sefer Hasidim does not elaborate. He just writes that Ploni Almoini gave away his life to salvage and save the life of Rebbe Kiva. I don't think that is halacha psuka. So let's just try to summarize the various opinions that we put on the table, al shulchan malachim. The Chassam Sofer says a person is mechuyev, put his life in danger to save another person from a greater danger. The Chassam Sofer is a surprise, because that is what the Agos Memonias quotes from Yerushalmi, but the Sma argues it's in B'S Yosef, it's not in Shulchan Aruch, because it is not the halacha. So the vast majority of poskim maintain, no, one is not mechuyev to put his life in danger to save another person from a greater danger. Is he entitled to do so? Some poskim say yes. The Orach Chaim goes to the extreme to argue he is entitled not only to endanger his life to save another, he is entitled to give away his life to save a fellow Jew. But as I explained, that is a das yochid. I think the most relevant source, as I said before, is the Radbaz, and according to the Radbaz, there are various different levels of sakana. If the sakana is minimal, it might even be a chiyuv. If the sakana is substantial, but still not a great sakana, it would be midas chasidus. If the sakana I am putting myself into is close to the sakana upon that other person I am trying to save, according to the Radbaz, that would be chasidus shel shtus, and it would be a prohibition. What is the Yerushalmi? Well, I have went through the Yerushalmi many times, and I think there is only one source in the Yerushalmi, and probably that is what the Agos Memonius means, even though he does not specify. In Masechet Trumas Daf Mem Zayin Amud Aleph, there's a story in the Yerushalmi. Rav Eini Itzad. He was captured, taken into custody by ISIS. It's not the Yerushalmi ISIS, but some similar cult. And they obviously were cannibals. And they snatched him in order to kill him. And when Rabbi Yonasan heard that Rav Amy was hijacked, was kidnapped, he responded by saying, to my dismay, we might as well prepare tachrichim. Meaning to say, there is no chance of getting him out alive. Reish Lakish was there, and Reish Lakish said, I am going on a rescue mission. Either I will kill, or I will be killed. But I am going to try to bring him back. That is what Reish Lakish said. If you are familiar with Reish Lakish from different sources in Bavli, he was a fighter. He was a Baal Tshuva. And obviously before doing Tshuva, I don't know, but probably he was a martial arts expert. I don't know in which of the martial arts, but he was a real fighter. So Reish Lakish said, no, this is unacceptable. I will engage them. Either I will be killed or I will bring him home. And the Yerushalmi continues by telling the story that Reish Lakish actually went out there, and when they saw him, they were obviously frightened. He negotiated, and he brought Rav Amy back alive. And that story had a happy end. So the Goyas Maimonides proves from Reish Lakish that a person is required to put himself in danger to save another. Because Reish Lakish, with all his talent and all his strength, definitely put himself in danger. He himself said, either I'll be killed or I will kill others. So it had a happy end. So it is from this story that some of the Rishonim maintain a person is required to put himself in danger to save another. But I don't really understand. All we could prove from that Yerushalmi is that a person is entitled to do so, but not that he is obliged to do so. Rabbi Yonasan responded by saying, we might as well prepare tachrichim. Rabbi Yonasan didn't try to put together a rescue mission. So how could we learn from this Yerushalmi that a person is mechuyev or obliged to put himself in danger to save others? All we can learn from this Yerushalmi is that he's entitled to do so. But more or less, this is a summary of the various different opinions. Now, getting back to our basic question, this is a dilemma which comes up in various different areas, especially in the medical field. Not long ago, the world was dealing with the outbreak and epidemic of Ebola, primarily in Africa. And I was asked by various doctors in Israel, or in America, should we volunteer and try to go out there when there is a certain degree of danger that you might, it is a virus that is extremely contagious. In Israel, there was a doctor that refused to operate on a patient that had hepatitis B or C, because he was afraid he might be affected, and that caused a big controversy in Israel. MADA, Magen David Adom, the equivalent of the Red Cross in other countries, according to their rules and regulations, a paramedic should not administer mouth-to-mouth resuscitation, only if he has that special kit to avoid direct contact. And I was asked many times by volunteers of Hatzalah and by MADA, and who did not have the kit, could they do mouth-to-mouth resuscitation when they are exposing themselves to a certain degree of sakona? So these are various different questions in which we are confronted with a dilemma. To what degree does a person have to put himself in sakona to save others? So these questions deal with the medical profession, but the most common manifestation of this question is donating a kidney. Kidney donation within the family or without. I am extremely inspired and I stand in awe seeing people donating kidneys not only to save family members but even people that they don't know. And I think that is the ultimate chesed. Nothing could compare with the chesed of giving away an organ, giving away a kidney to save a fellow Jew. And many have been forthcoming to donate kidneys to save. Well, when it's in the family, it is more reasonable. So according to the sources we have brought, it definitely is permissible. It is far more than permissible. I think it would be defined as a midas chasidus to donate a kidney to save another person, because the sakana upon the donor is extremely minimal. And the chesed we are doing with the recipient is tremendous. And sometimes it is really a lifesaver, and it makes a difference between life and death. So many years ago, some Rabbanim came out against kidney donations. Maybe in that time, the risk the donor was taking upon himself was extremely substantial. But today, it is minimal, far less than 1%, far less. And therefore, it definitely would be defined, in accordance to the sources we just quoted, as a tremendous mitzvah. I would not go to the extreme of saying it's a chiyuv, but it definitely is a mitzvah, and in midas chasidus. So could I say exactly what percent would be considered a prohibition, what percent would be considered permissible, and what percent would be a chiyuv? No. And one of the basic axioms I speak about many times in Israel is that Rishonim, Chazal, the major poskim going back hundreds of years, never spoke about percentage points for a very simple reason. If you don't do statistics, how would you know? And statistics is a totally modern concept. In the days of the Beis Yosef, nobody did statistics, so how could he speak about 10% or 20% or 30%? How would you know? So all we had in previous generation was a general feeling. And in Chazal we find generalities. Miut hamotzui, miut she'enoi motzui. Rube de rube, rube de minkar. We do not find percentage points. And therefore, I cannot speak about numbers. And sometimes people are disappointed because in our day and age, we would like to come to a rov and have very definitive answers. And sometimes people ask me questions of the nature, so how much time does a person have to wait? And I respond by saying, 2 hours, 31 minutes, and 12 chalokim. Like we say by Birchas HaChodesh. But no, that is not the language of halacha. Halacha doesn't work that way. So I would roughly say, definitely in a case of kidney donations, when the sakana you are exposing yourself to is so minimal that it definitely is a midas chasidus and a mitzvah, beyond doubt. If the sakana you are exposing yourself to is reasonable, I would say 10% to save another person that is an imminent and immediate danger, that would be permissible. And according to some sources, it is always permissible to put yourself on the line in order to save another person. 2 additional principles I would like to put on the table before we take questions. I think when a yochid jeopardizes his life to save the many, that is always permissible. Not a chiyuv, but permissible. For the basic logic, toive mashnayim in uechad. And the individual is entitled to put himself in danger to save the many. A few months ago, there was this tragic terror attack in Har Nof. And it was one of those events that brought us all together. And I think the entirety of Klal Yisrael, we all skipped a heartbeat, and we all were united in tragic agony and in mourning for those families. So one of those killed in that shul in Har Nof, and my dear friend and assistant Rabbi Sprung, who you came to know, was actually deeply involved, living in Har Nof with helping the families after that tragedy. One of the people killed was Aryeh Kupinski, and he was a real hero because he engaged the terrorists and he fought them with chairs and benches, and he was murdered. But his sacrifice enabled many to flee and to save their lives. And when I went to be Menachem Mordechai the family, we discussed this dilemma and this question. So did he do the right thing? He put his life in tremendous danger, and ultimately, he was Moisei Nefesh. He gave away his life. But due to his sacrifice,
He was there. His father's from here.
really?
Yeah.
Went to Beis Yehuda.
Oh.
Went to Beis Yehuda.
He went to Beis Yehuda, where we are actually standing right now. Hashem Yinkum Domo. And he should be a Meretz Yosef for this community and for all the others. I was so impressed by the family. So some of you know his father, know the family. So when I went to be Menachem Oval, and I am going out of context right now because I am moved by the fact that he's from Detroit. So when I went to be Menachem Oval, the family, the father spoke from the depth of his heart, and he said, I moved from America to Kiryat Arba. I have 3 children living in the Shomron, and I worry for them every day. I had 1 son living in a relatively safe area in Har Nof. I never worried about him. Who could figure out Hashgacha? Raising his family 25 years in Kiryat Arba, having 3 married children in the Shomron, and where does tragedy strike? In Har Nof. So I always tell people, people come to ask me, could we live here, could we live there? We could live everywhere. Wherever Jews live, you could live. And we believe in Hashgacha Protas. Tragedy strikes, not always you expect it to. So that's an amazing family. So did Aryeh Kupinski do the right thing? Yes, definitely. Because the individual is entitled to put his life on the line to save the many. In Tanis Daf Yud Ches, the Gemara speaks about Papus veLulianus, 2 brothers, that they were Moisei Nefesh, v'mechitzotzom lefonim v'mechitzotzom shomalachi Hashoros. And they are in a higher place than the angels from above. And the Gemara doesn't tell the story. Who were Papus veLulianus and what did they do? But Rashi relates the story. In Lud, the daughter of the boss, I don't know how to define him, the king, the emperor, the tyrant, the boss, the godfather, I don't know how to describe him, I don't know who he was, but his daughter was found killed. Who killed her? Well, probably the Jews. Who killed them all, if not the Jews? So, he summoned the Jews and he said, if you're gonna give out the murderer, we're gonna spare all the rest. If you won't, we're going to destroy you all the Jews of the city. Papus veLulianus were totally innocent, as we could imagine. They were great people, but they stepped forward and they confessed. False confession to save all the others of the city. And Chazal point out that they were Mikad Sheshem Shemayim, and they will live for eternity in Gan Eden in merit of their Mesirus Nefesh. We don't really know the details. Maybe Papus veLulianus didn't even live in Lod. Maybe they weren't Bechlal HaSakona. Maybe they could run away and salvage themselves. But they gave away their lives to save the others. And it is from here that we learn that an individual is entitled to give away his life to save the many. And that goes beyond doubt. That is one reason Aryeh Kupinski did the right thing. The other reason is, many Achronim, primarily the Chassam Sofer and Simon Dalet, point out, in military service there are different rules. So the general rule is Chayecho Koid Malachai Chavecho. Go to the army, whose basic axiom is Chayecho Koid Malachai Chavecho. No, in military service, the basic axiom has to be Chayechavecho Koid Malachayecho. And we expect warriors and soldiers definitely to put life on the line for their buddies, for their friends, and to save the people they are out there to save, their families in the home front. So the Chassam Sofer and Simon Dalet Choshen Mishpat points out, B'Shas Malchama there are different rules. And I want to broaden the scope of this Chassam Sofer. It is not only B'Shas Malchama. Every decent society has some people, volunteers, who are willing to jeopardize their lives for the benefit of the broader community. Well, it's probably safer to be a clerk in the bank, maybe not in the bank, but somewhere else. It's probably safer to be a clerk somewhere than to be a cop on the beat in central Detroit or in the Bronx in New York, or to be a firefighter, or to be a rescue diver. There are people that volunteer to different services that always involve a great level of danger. Would we say that as a prohibition? So how would a decent society function when everybody will say, "Chayechu koidem lachayech avecha"? So how would our society look without cops, without firefighters, without rescue divers, without people that are willing to put their life on the line for the benefit of the greater community? And that is the same reasoning as the Chassam Sofer and the Netziv that say B'Shas Milchama there are different rules. B'Shas Milchama there are different rules, but even in our every day-to-day lives, some people have to be out there who are willing to go that extra mile and put their life in jeopardy for the benefit of the broader community, and that definitely is mutar lafi halach. So if you decided to be a doctor, you are expected to treat patients regardless, and you cannot say, "I don't want to treat a patient that has hepatitis B." If you decided to be a doctor, that is the risk you have to take upon yourself. The risk is minimal. It's not major, but that is part of your profession. And this is an additional reason. What's happening in Eretz Yisrael with the terror would be defined in a way as Shas Malchama, and a person is entitled to put his life on the line in order to save others. So besides the people killed in that terrible terror attack, in that same period, many people were wounded, and I was in the hospital to visit a young man from Gush Etzion who engaged a terrorist, and he was stabbed 5 times in his body, but ultimately he overpowered that terrorist and he saved many others. A similar story. Baruch Hashem, he made it, and he's doing well, he's doing fine. So that definitely is Mesiras Nefesh, definitely is permissible. And the most famous story is the story of Roy Klein, a young frum officer who threw himself on a grenade, and he was instantly killed. And that was his ultimate Mesiras Nefesh, to save his entire unit, soldiers who he was their commander. And that definitely is an act which is not only permissible, but the ultimate Mesiras Nefesh. And so the individual is entitled to endanger his life and give away his life to save the many, especially in a situation in a time of war, when we are fighting against So these are some general ideas and general discussion, and now I give the authority over to my dear friend, Dr. Tenenberg.
Yes. Mipnei Darkei Shalom, how does this apply to the non-Jewish population? So, for example, a physician going to Africa to treat Ebola patients.
Yes, that is a very sensitive issue. But let me make something clear, halacha l'maisa. The way we treat non-Jews is exactly the same way as we treat Jews. And that is a very firm sack that the vast majority of Gedolei Yisrael formulated for the past 200 years. The first source being a very important shuv in the Divrei Chaim. The Divrei Chaim was one of the greatest poskim in his time. Coincidentally, he was the Tzanzarov, the head of the Tzanzar Hasidic dynasty. So he also was a Hasidic Rebbe, and also one of the greatest poskim of his generation. And in Shuvas Divrei Chaim we find Shumati, that it is a Takona Vada Arba Rotzos, which is a big surprise, because we have various sources of the Takonas Vada Arba Rotzos that is not found there. But nevertheless, the Divrei Chaim paskins. The way we treat non-Jews is exactly the way we treat Jews, and we're Machal Shabbos to save non-Jews, even with a malacha d'oraisa. Regarding, would doctors be entitled to volunteer to treat Ebola patients in Africa? Yes, because the sakona is so minimal, I think, to bring health and salvation to people is always a mitzvah. Chov Avodam Shenivro B'Tselem Elokim applies to non-Jews as well, and because there is also a great deal of Kiddushem Shemayim involved, I paskin for various doctors, they are entitled to volunteer to treat Africans and the Ebola virus.
Okay, we'll take one more question on this topic, and then we'll open it up to general questions.
And when they
Go
bring
ahead.
an injured Mechabel in, when he fixes something to go out and kill more Jews, how is that handled?
Look around, and if nobody is seeing, strangle him. No, I don't mean that serious. Many doctors have great...
Repeat the question, please.
When a Mechabel, a terrorist, is brought into the hospital, do you treat him? Many doctors would have great difficulty, but I think it is to the kavod of a society and of Israel. Yes, he is a human being. He will be tried in court, and he should be given what he deserves. But he is a human being that's injured, and he needs treatment. So I think we should treat every human being that needs our attention. And he has to be dealt with, and he will be dealt with in court. But as doctors, we need to treat every human being that needs our help.
How does Loises Chonaim fit into these, how you're focusing for us?
Oh, did you plan this out, Dr. Tenenberg?
No.
Yeah. Let me shortly once again reiterate what I said. This is a very sensitive topic. Without getting into many details, I once again say, the Divrei Chaim wasn't a progressive rabbi. He had nothing to do with the reform or Haskalah movements. He was a Hasidic Rebbe, as far as it goes to the extreme right. But he was one of the greatest poskim. And halacha l'maaseh, he said, we are mechalal Shabbos with a malacha d'oraisa to save a non-Jew, and we treat him exactly in the way we would treat a Jewish patient. Let's move on.
Okay, let me there are a couple people that I know have questions. We'll have them address, and we'll see how much time we have left. Dr. Ilya Kot has a question about DNR order forms in the hospital.
So, patient comes into the ER. Usually the first person to see them, and they a lot of times, especially they're coming from a nursing home, whatever else it is, they're an elderly patient. They already have their, specific decisions that they have for whether they do or do not want to be resuscitated in a situation where their heart was to stop. The hospital then hands me this big blue piece of paper, which is very visible in the chart, where I'm to jot down what it is that the patient wants, allow natural death, or yes CPR, no CPR, yes intubation, no intubation, and that gets placed in the record.
And you have no choice but to do and fulfill what the patient demanded. So in that case, I think you should have a Tillim with you in your medical kit, in your unit, and sometimes all you could do is take out your Tillim and daven, because you're living in a modern world, and if you will violate the patient's wish, you will be in trouble, and you don't have to jeopardize your career, and it's futile, ultimately. Somebody else will do the job. So we're dealing with a Sheval Taisa. You can't pull the plug. And if the plug needs to be pulled, you leave that to another doctor. But when we're dealing with Sheval Taisa, if he doesn't want to be resuscitated, you cannot resuscitate him.
But is me signing that blue piece of paper counted as a Shavel Tasa?
Yes, but that's a formality. That is a formality. You bear no responsibility because you signed that piece of paper. If you won't sign it, somebody else will sign it. That is a mere formality. That is not something you need to see as a problem. You cannot pull the plug b'kum v'aseh, but if a patient doesn't want to be resuscitated, you cannot resuscitate him. So in that stage, you say to him,
Dr. Gabe Sosny.
Otherwise, two-pronged question. Number one is the Stipler and the Kreiner de Igrissa writes in, I think it's Kuf Tzadi, about Sheva al Taseh. In many end-of-life issues, is preferred to actually doing something more invasive. So I would just like the Rav's opinion, how much weight that letter from the Stipler weighs in decisions. And part B is how much weight does the patient's opinion about how much they would like to have done weigh in the decision as well?
well, yes, I dealt with this question at great length in the first volume of Shalas Teshuvos Minchas Osher. The letter from the Stipler is a big tema b'yeinai, because he comes across as being so lenient, far more lenient that would suit my taste. And the Stipler seems to write that if a person is very ill and he doesn't want to be helped, you're not mechuyev to help him. And that is such a broad ruling that it is very strange. Bearing in mind that the Stipler didn't see himself as a posek, but rather as a Rosh Hashiva and a Marbitz Torah, and bearing in mind that that was a letter and not what we define as a tshuva, as a halachic ruling, I think that that must be taken with a very limited scope. What is more substantial is the Piska Halacha that we find in the Igros Moshe and from Reb Shimon Zalman. And they are a bit more precise in their rulings. And I went into great detail in the first volume of Teshuvos Minchas Osher. We deal a lot today with the concept of patient autonomy. A patient does have a certain degree of autonomy, even a great degree of autonomy, al pi halacha. So when a patient is terminally ill, and all we could offer is some additional time of suffering and pain, he is entitled to say, I don't want this. And then it is halachically permissible to be shev al taisa. You must always give him the basics: oxygen, nourishment, antibiotics, but you do not have to go beyond that. If he wishes to be treated, you are mechuyev to treat him. So in those situations, in those end-of-life situations, a patient has a great deal of autonomy. And if the patient is not in a state of mind in which he could decide, his next of kin, his immediate family members also have autonomy. And we should respect what they wish for their loved ones. So that is a general response. I don't think we should go into very many details. You know, dealing with that letter of the Stipler, I also expressed bewilderment about Reb Shimon Zalman's ruling. He deals with an elderly ill person, and the doctors want to amputate the leg, and he says he cannot see himself without a leg, and it's a begia in his covered, and Reb Shimon Zalman says in that case we should respect him, which to me seems to be also too far. Because after amputating a limb, a person could have a Yichas Yomim Rishonim. And why would that be a P'giya B'chvaydoi? I think he needs some psychological therapy, and it needs to be explained to him that you could be a very respected member of your family and your community without a leg. So if he thinks it's a P'giya in his covered, I think we should deal with that emotional problem or psychological problem, and that is not a basis for preventing treatment and bringing and allowing the demise of a person. However, in a case in which a person is terminally ill, and by our medical knowledge, we know that he has a few weeks or a few months, and all we could offer him is prolonged suffering, then he definitely has the autonomy to say, I do not want this.
All right, Dr. Mark Meisner.
Of Weiss. Mr. Danny Brown, Chavus of mine and I have come across in our learning that a cheresh very often in Shas is in the category of shaita or kotans and not allowed to be. Given today's day and age where there are so many more therapies, hearing impaired people and even mute people, therapies, technologies to improve that are fully integrated in society, seem to be able to be cognizant. What is the halachic status?
Oh, I see that nobody here really knows the Shalas Chuvas Mincha Social. And I'm very, very disappointed on the personal level. Because in Chuvas Mincha Social Chelik Beis, I dealt with this question at great length. And I expressed my opinion that those Chesham today have a din kipikach lekol davar. And one of the chuvas I wrote, which caused a great lot of commotion and controversy, is I suggested changing the minig that has been for decades in Eretz Yisrael. They did not say a brocha by kiddushay cheresh v'chireshes, and I ruled that that is a mistake. And in kiddushin between two deaf and dumb people today, my psak was you could say the brochas with Shem u'malchus. Because I think it would be totally off the wall to say that these people have a din of a shaita when they're functioning members in society, and there actually is a group of Yungalite, a koil in Yerushalayim, of deaf and dumb people. So these people are learning Gemara, they are writing Chaburis, and we will say they have a din of a shaita and they can't be mekadesh isha. So my ruling was that we should say a brocha b'shem malchus b'kiddusha cheresh v'chireshes, and I think that they have a din of pikeach in our day and age when they are fully functioning members of society.
So Bezos Hashem and the Mashiach will come soon. All the strictures that are listed in the Mishnayos and in the Gemaras that they cannot do truma taking will be abolished, because at that point
No, they will be abolished because when Mashiach will come, all the chershim will suddenly be able to hear, and all the blind will see, and all the dumb will speak. And that is why those halachas will no longer be relevant.
All right, Dr. Jason Weinberg.
Thank you. In America, we have Shomer Shabbos residencies so that young doctors do not have to expose. Sorry, in America, we have Shomer Shabbos residencies so that young doctors don't have to expose themselves to Shomer Shabbos. But we do not have Shomer Shabbos medical schools, and we have patients within medical school. And it's very difficult to go through these and not face sort of the rise. I wonder if the comment.
Well, I wrote a letter not long ago to a
Could the question get repeated, please?
regarding Shomer Shabbos residencies. So I don't know his name. Binyamin Weinberg asked, but in medical school you don't have the opportunities for Shomer Shabbos, and sometimes you are confronted with a situation in which you need to do a malacha diuraisa. How do we deal with that? I recently wrote a letter to a very choshev doctor in Pennsylvania who asked, would we recommend Bechlal to young people in our society to go to the medical profession when there are so many weighty and difficult shilas in halacha? And I wrote at great length, we have one of two paths to choose. We could disengage from the modern world and not go to medicine because of the halachic shilas, and not have from nurses because of the halachic shilas, and not have from lawyers because you have so many shilas dealing with erkois and with other monetary issues, and not having from people volunteer to the Mossad because there are so many shilas, and not having people in finance and in commerce because there are so many new shilas, having businesses. How do you deal with Shabbos, having hotel chains or other? So, would we decide that all our children should be chaytvei eitzim, shayavei meim, or learn in kollel? That is one option. The other option is, I think we should be everywhere in all segments of society, as long as we could deal with shilas and find solutions. But if you can't find a solution, I said yesterday night, we will be willing to go back to the Stone Age and not violate our precious Torah. Ein chochma ve'ein tvuna ve'ein eitzim neged Hashem. So on one hand, I think we should be everywhere, because from doctors and from nurses and from lawyers are doing such a tremendous service to our community. Sometimes we could even describe it as pikuach nefesh. When people are desperately ill, especially in America, when the trend in the medical profession is, old, feeble, ill people, just let them die, and that is considered humane. So from doctors are doing such a tremendous service to those that desperately need them, and from nurses are doing such a tremendous service when you need a varm Yiddish hearts in a hospital sometimes, and a good Yiddish word. And from lawyers are doing a tremendous service sometimes to save people from persecution and I don't want to mention names, but there are so many cases which we desperately need from lawyers. And in Israel, we know it from people in the intelligence community, and we need them everywhere. So I think we should not run away. We need to rise to the challenge and deal with halachic issues. However, if we cannot solve those issues, then I don't think there is any heter, especially not when we need to do a malacha d'oraisa to learn medicine. So we need to solve these problems, because there is no heter to do a malacha d'oraisa when there is no chodesh sheyesh b'sakona lefaneinu, just in the process of learning. And therefore, I am very happy to learn that there are numerous opportunities of Shomer Shabbos residencies. In Israel, we don't have that. No hospital in Israel will be willing to let you away for Shabbos, because if they would be willing, then 70% of the doctors wouldn't want to work on Shabbos. But in Israel, the problems are lesser than in America, because the majority of patients are Jewish, and there is more understanding in the hospitals. You could have a non-Jewish person write what needs to be written. So in Israel, the solutions are easier to come by, and the vast majority of patients are Jewish. But in America, I think Shomer Shabbos residency, that is the way to go. And many times I'm asked by doctors, but I could get into a more prestigious college or hospital, and I will be better at my profession, but they don't have a Shomer Shabbos residency. And I say you need to go for the Shomer Shabbos residency. So if it is a situation and we cannot avoid and prevent malachas d'oraisa, I don't see any heter to get into it.
Mrs. Elchanan.
My question is, with the advent of technology and people, you used one of the criteria that you used was pain, but there are people that are beyond pain, that are not conscious, so you can't actually say that there's a factor of pain. What's the cutoff? Is there any criteria or any middle ground that you could define of how far you have to go?
I think these type of shalas need to be dealt with on a very personal basis. One general comment I want to make: not always could we determine whether a patient feels pain or not. Many times we can, but the fact that a patient is unconscious doesn't necessarily mean that he does not feel pain. When a patient is brain dead, we know that he doesn't feel pain. But the fact that he is unconscious does not mean that he doesn't feel pain, and it is difficult to determine. And if I said anything that is amaratzis, you are entitled to contest what I just said, but I think that is the medical fact. Even if he isn't in pain, not always do we have to do everything within our power to prolong his life. And that is just a general comment I want to make. But I think beyond that, we need to deal with every situation as is.
I'll ask one quick follow-up question while people are thinking about other ones. In the cardiology area, we often have patients who have put in defibrillators and pacemakers, which both shock their heart when it has a deadly heart irregularity, or correct a heart rhythm that is abnormal, which can also result in saving the person's life. Sometimes those patients later on in life then develop a terminal illness. Is that person allowed to ask his physician, and may a physician turn off the defibrillator or pacemaker function so that the next time a deadly heart irregularity develops, he will perish because the pacemaker will have been turned off?
Is that the defibrillator for the brain when you're not doing that well?
Not yet. Not yet. You may want to tell the joke about the brain transplants.
Yes, I wrote about this. I wrote a tshuva about this, but it's not printed in the Mincha Social yet.
I should have asked that question.
You were supposed to.
And I definitely think that there is no reason why the defibrillator cannot be disactivated. Because if the person is terminally ill, and for instance, he has advanced cancer, and he would have a heart attack, and we would not be mechuyev to go to extremes to resuscitate him, that is the same with the defibrillator. The defibrillator has not become part of his body, and taking it out or activating it would not be considered as if we're taking his heart out. It is something which is totally external. And in those situations in which we are not mechuyev to give him electrical shocks to bring him back, we also are entitled, he is entitled, to disactivate the defibrillator.
So it's like Kumar's case of assault?
No,
On tongue or?
no. I think many are confused with that halacha brought in the Ramah, that you could take salt off his tongue. We do not really know what that salt will do, or kol patish. But I think the understanding of that halacha is that is only ma'akev yetzias neshama. That is not defined as life. That is nothing. But a defibrillator is not a segula. It's not a kameya. We know exactly what it does, and it's a lifesaver. So I don't think it has anything to do with that halacha of melach al or kol patish doifek. But I think it's a very simple svara, very simple reasoning. All the defibrillator does is what a doctor would do with shock treatment, but it's just on the spot. It's instantaneous, it's immediate, and that's why it is preferable. But it's totally external. So in all those situations in which we would not be mechuyev to resuscitate and give electric shocks to his heart, we also are entitled to turn off the defibrillator.
A question was asked, what is the Rav's approach or opinion about alternative medicine?
Minchasosha Chelak Aleph. Minchasosha Pashas Bechukaisai, going far back before Shalos Yeshuvas. I'm not a big chassid of alternative medicine, but I am also convinced that there is something to it. But it's such a broad range. There's a lot of nonsense in the field of alternative medicine. But probably some procedures, some medicines are real. And therefore, using alternative medicine as a supplement to conventional medicine is many times recommended. When conventional medicine no longer has what to offer and people want to turn to alternative medicine, I think we should encourage them. But going to alternative medicine instead of medical attention and treatment, I think that would be a grave mistake. Could I say it's osur al pi halacha? This is something very relative, and if a person believes in something, how could we say no? But I think it's a mistake. And from the little that I know and experienced and learned, I definitely think conventional medicine based on trial and effect and examination and statistics and logic is definitely for real, while alternative medicine that lacks all the above mentioned, I think some of it is substantial, a lot of it is nonsense, and therefore I definitely think we should try to persuade any patient that could have medical attention to get conventional medical attention and to prefer it on alternative medicine. But I cannot say that alternative medicine has no place in our society. As a supplement to conventional medicine, or in cases when conventional medicine has nothing to offer, a person definitely is entitled to turn to alternative methods.
Dr. Friedman has a question. He is a neurosurgeon, so operating on the dura or the coverings of the brain.
Nikaf Krum Shalmoyach is a treifa. We do it every day. Is that person considered a treifa? And if you kill him, you're potter?
Yes. So are we entitled to kill a person and then do Tchias HaMesim? That is your question, right?
No, my question is, once I've operated him, he's recovered from surgery, he's considered a treifa now.
Yes.
So now it's
So you cannot eat him.
No, to go out and kill a treifa, you're potter.
Mm-hmm.
It's not Resicha. He's going to die anyway.
Okay. That's an interesting question. First of all, it's a major discussion whether treifas the Adam are the same as treifas the Behemoth v'Oif.
Excuse me, just to elaborate on the question, the Gemara talks about when you make cuts on the coverings of the brain, that renders a person the status of a treifa, meaning someone who is destined to die within 1 year, and the halachos related to that person are different than a normal person who's going to live a long life. However, in today's modern age, we operate on the brain every day, and we cut those coverings routinely, and those people completely recover and live long lives. So how does halacha view that? Is there still a status of a treifa on that individual for various issues?
So, but I don't think this question has any halacha l'maaseh implication, because if you ask, am I entitled to kill a person after he had brain surgery? No, you're not entitled to kill a treifa. If you kill him, then you have no mises based in, but you're not allowed to kill him. So I don't think this question is halacha l'maaseh at all, but I will respond nevertheless. Many authorities maintain that treifas the Adam has nothing to do with treifas the Behemoth v'Oif. It is totally different criteria. And the Yud Ches treifas described in the third Perek of Masechet Chulin refer to Behemoth v'Oif. The concept of treifa the Adam is a totally different concept, and it does not depend on those definitions that we find in Hilchos Treifas. That is one point. The other point is the Chazon Ish, and it goes back till Shuvas Rashba, already grappled with the fact, Chazal say treifa lo chaya, but in our day and age, I think 60% of adults, especially elderly people, would be defined as treifas. Because anybody that had internal surgery, not only Krum Shalmoyach, most people that had any internal surgery would be rendered treifa according to the definitions of Hilchos Treifas. So, in our day and age, most of the treifas could live long lives. Not only people, even behemoths, even animals. There are certain surgical procedures performed on animals as well, and they also live for years. So the Chazon Ish comes up with an amazing idea to explain, even though most of these treifas today have a normal lifespan, doesn't affect halacha. So that is relevant also to surgical procedures on human beings.
Several years ago, there was an issue with the cows. The cows developed this Ben Adams used to puncture the cows. Are these
Right.
cows considered treifas now? Because they live.
Yes, but that would not affect Hilchas Treifas. The fact that they live would not affect Hilchas
So would the
Treifas.
milk be from a treifa? You get the milk that you get from these cows.
I thought this is a medical conference, not one dealing with kashrus.
We might have a
You know,
veterinarian in the audience.
Yes, next time we'll have a kashrus conference. This is a kashrus question, not a medical question.
Okay, we'll take one more question from Dr. Sosny, and that'll conclude our morning.
What is the Rav's opinion about lefanenu regarding transplants? We know that if you take an organ from someone to get, assuming you do it halakhically kosher to get an organ, what is the guidelines for lefanenu? Because we know today you could basically be in Seattle in a number of hours.
Once again, I don't think the question is relevant.
Why?
Because B'fanenu is a concept dealing with pikuach nefesh. I don't think there's any organ which could be harvested after cardiac arrest. You could take skin, and skin usually is not pikuach nefesh. You could take the retina of the eye, which once again is not pikuach nefesh. I don't think there's any organ which could be taken out of a cadaver which would be a lifesaver. So I don't think the question of lefanenu is relevant. The kidney is the only one. But the medical establishment always prefers live donors to cadavers dealing with kidneys. And, you know, cadaver kidneys is almost out. So I don't think the question is really...
A corneal transplant would be...
But it wouldn't be a lifesaver. It wouldn't be a lifesaver.
So Rabbi Weiss doesn't feel that
I think the concept of lefanenu
Restoring
is
vision
when
is
there's a
not-
cholesh sheyesh bo sakana. Restoring vision is not a lifesaver. And therefore, I don't really think the question is
There is donation after cardiac death, which does happen in Israel and does happen in the United States as well, where they allow a patient's heart to stop for anywhere from 3 to 7 minutes
And then they-
and quickly
Then they
harvest.
take it.
Although there are a lot of other issues that happen to the patient before that happens to facilitate retrieval of organs. But I don't think we have time to fully
Okay, yes,
answer that
I
question.
agree with that. So it was... It was a pleasure to be with you this morning. I think it was very, very important, and we dealt with many serious and relevant shilas. It was an inspiration to me, and I hope it was a benefit to all of you. And we're going to the koil, so we still have some time to say goodbye.
Yeah, I will please ask everyone, the Rav has to be at the Kollel at 11 o'clock to give a Shir Iyun. We have about 1 or 2 minutes before he has to be whisked away, so I ask the Olam not to